Her loss will be felt by so many.
New Jersey's governor marks the death of Susan Sakala, a nurse who succumbed to COVID-19 in 2020. A fever and worsening cough prompted her to go to the emergency room in March. As her breathing and blood pressure deteriorated, she was put on a ventilator. 11 days later, at the age of 60, she went into cardiac arrest and died.
She was like most of us our age, trying to get ready to, I guess, retire.
Susan's husband, Steve, is now seeking compensation for her death from a little-known government fund called the Countermeasure Injury Compensation Program, or CICP. The $30 billion fund was set up a decade ago to compensate for death or severe injury caused by treatments or vaccines in a declared pandemic, epidemic, or security threat. Sakala's attorney believes they have a strong case because Susan was given both azithromycin and hydroxychloroquine.
Susan did receive hydroxychloroquine, and it did cause the QT prolongation, which can be measured by an EKG. But what made it worse is that she had a second covered countermeasure, which was azithromycin. Those two in combination are known to be deadly now.
Former U.S. President Donald Trump once touted the drugs as a cure for COVID, despite concerns about its safety from the mainstream scientific community.
Many doctors think it is extremely successful. The hydroxychloroquine, coupled with the zinc and perhaps the azithromycin.
The same month that Trump made that statement, the U.S. FDA cautioned against using hydroxychloroquine for COVID-19 patients, citing reports of serious heart rhythm problems. Amid a public health emergency, drug companies and healthcare providers are largely shielded from lawsuits. Claims of deaths or serious injuries are instead filed with the CICP. The program so far has denied compensation in 90% of the cases brought forth pre-pandemic, largely for the H1N1 flu vaccine. But it now faces its first set of challenges, roughly 50 lawsuits related to COVID-19. If Sakala can successfully show the treatment led to his wife's death, he could receive around $367,000 from the fund.
There's nothing that's going to bring her back. But obviously with our two children and now two grandchildren, if there's something that we could do to help them out, that would be nice and helpful.
Karina Huber, CGTN.